Uganda's President Yoweri Museveni has announced that schools will be reopened in January, almost 2 years after they were closed because of COVID-19. Now, Museveni says that this will happen regardless of how many people have been vaccinated. Under 10% of Uganda's population has been jabbed so far. And for more on this development, we're now joined by Nabendra Dahal, who's the Chief of Education for UNICEF in Uganda. Thanks very much indeed for joining us and welcome to the program.
My pleasure. Greetings to you and to your viewers.
77 weeks away from school, and this is the worst in the world. This must have had quite an impact on the children's lives, not being able to have normal education for such a long period of time.
Yeah, it has been a long period of time, and as you rightly said, it of course has a negative impact on the lives of children, like everywhere else where the schools were closed. Long or short, any closure of a school has a negative impact on children in different forms. First, they learn the opportunity of being in a very positive environment where hope is promoted. They can look forward to a brighter future. When the schools close, that is taken away from them. They lose whatever learning opportunities they get, and worse, they even forget what they have learned when the closure is long. So there is a problem of learning loss. They also lose other opportunities and services that schools provide. Schools act as a platform to provide integrated services to children. When schools close, that also gets affected. For example, children's safety, security and prevention from violence, that also gets affected. They face increased risk of violence. In Uganda, particularly, the children are facing, mostly the girls, are facing increased teenage pregnancy. Many children have been put to work. Child labor has increased as a result of school closure, almost by 50% compared to the time before the schools were closed. In many cases, they lose vaccination opportunities, school meals, and many other supports that the schools provide to children besides just teaching learning process.
So good news that the schools are opening, but I suppose there is a fear that many of these children won't be going back to school, particularly girl children who traditionally, sadly, have always been the last on the list in terms of access to education. And with them being out for so long, it becomes difficult to compel a reason for those people to send them back to school.
That's true, unfortunately. Children have become at least 2 years older than they would have been in, by now they would have been in upper grade. Many children, for various reasons, maybe their parents' economic status, maybe they have to bear family responsibility, maybe because they have also lost interest in education because they have become older and they may not be interested in the kind of lesson they may have to go back. So there is a fear, genuine fear, the risk that many children may not return. But there are mechanisms being put in place to bring as many children as possible back to schools. The development partners, including UNICEF, will support the government in that report. The government is also mobilizing all its resources, its network in the community. The Right Honorable President was also very explicit in mobilizing the lowest level of government functionaries in supporting vaccination for school reopening. So yes, it has been a difficult time, but the government and its development partners are committed to do its best to bring all the children back to school and give them a positive learning environment and help them recover what they have lost as best as it is possible to do so.
What has been the help that these children have been able to get in this past 77 weeks?
Thank you. That's a very good question. And the government of Uganda, and its partners, right from the day the schools were closed, work on a strategy for continuity of learning. Of course, it is easier said than done. And in a developing country where there are many challenges, not all children benefit the same way. But for the most marginalized children, the government, with the support of its development partners, provided what we call home learning materials or self-learning materials, prepared for self-learning at home. In many communities, communities came together in small groups, following SOPs, and helped the children learn together, maintaining distance outside in the community so that the self-learning materials were better used. The government and development partners, including NGOs, UNICEF and other partners, also supported the provision of lessons through radio, TV, and internet wherever it is feasible. So a comprehensive package of continuity of learning was provided. The government also tried to reopen the schools in a phased manner when it was possible to do so. And during that period, on one positive experience is all the annual examinations, the level completing, primary level completing, lower secondary level completing, and upper secondary level completing examinations were held successfully. The results were positive, and the mechanism for those who passed those examinations to move forward into higher education, higher level has been in place. So there has been support for children to maintain continuity of learning and move forward in the best as it was possible to do so during the COVID context.
Well, schools were closed because supposedly, and I suppose in many cases, was in the best interest in the children to keep them safe. However, the president seems quite adamant schools are opening no matter how far you've got with the vaccination program. Is that safe, or does that mean we're saying that perhaps we kept schools closed for too long?
We could argue that way, but in Uganda, the Right Honorable President and government have taken a very cautious approach. You may know that in statistics, only 126,000 people cases have been reported, only around 3,000 deaths. So the government has taken every possible means to put life before anything else. So the care for life remains even for school reopening. In the context of school reopening, even though we highly appreciate the commitment to reopen the school, enough mechanism has been put in place to ensure that vaccination coverage is achieved before January 2022. There is enough vaccine in the country. There is mechanism to ensure the vaccination is completed. 60% of the teachers have already been vaccinated, at least with one dose. And there are mechanisms put in place. The Right Honorable President, in his speech that you referred to, in his address to the nation, also put to task the government functionaries to ensure that the vaccination coverage is done. In any case, Peter, as you know, vaccination is not a prerequisite for safe reopening of the school based on the experience gained everywhere else. So there is enough reason to reopen the schools. It could have been done without putting a condition to vaccination, but the government decided to put life before anything else and take the biggest precaution. And we are confident that government will reach a reasonable level of vaccination, and the schools and the economy will open in January, and we highly welcome that move.
What do you think needs to be done to re-establish this schools being open? I mean, you can't just open the doors, kids sit down and they're back at school. There's probably going to be catch up and maybe even psychological work that needs to be done on these kids.
Thank you. This is the biggest challenge. Vaccination is not the biggest challenge. As we say in these days, every one of us have started to talk in COVID language. These schools in Uganda, which has been underfunded for decades, you may recall that the government of Uganda used to spend over 20% of its budget in education during the 90s, did a great job of bringing children from even the poorest family to school. But it could not keep up with the funding that was required. So underfunding has created what you may call pre-existing condition and morbidity for the education system. So that has made the education system more vulnerable to the impact of COVID. Now that we have to reopen the school, that weakness in the system has to be addressed, and additional measures need to be put in place to make sure that schools remain safe and children get a reasonable learning opportunity to continue their learning. First of all, children need to be brought back to school. As you said, many children may not come. Globally, UNICEF, World Bank, WHO, we are advocating that government should put every effort to bring all children, including the most disadvantaged, the girls, the poorest child, the child farthest away from the school, the disabled child. They all need to be brought back. And simply announcing school reopening may not be sufficient. We need to put efforts to reach them and to bring back the school. After they come back to school, we need to provide them all support, as you rightly said, psychosocial support. We need to meet the school system, need to meet the children where they are, not expecting the children to meet where the curriculum is. So that arrangement has to be made, curriculum needs to be adjusted, teachers need to be prepared for it. Children and teachers both may have suffered psychosocial impact of the COVID, and they need to be addressed. On top of that, after all, school is about learning. There has to be a mechanism for remedial teaching, for catch-up, and for acceleration, so that the academic calendar needs to be adjusted, curriculum needs to be adjusted, and the pedagogy and assessment mechanism need to be adjusted to meet the requirement of the children and teachers, not expecting the children and teachers to meet the expectation of the predefined curriculum.
I'm just wondering what's going to happen to those that should have left school 2 years ago. Is it that everything was frozen, the entire school system, so that everybody just progresses 2 years later, or what's the arrangement?
Not exactly. In fact, the government of Uganda put its best effort to keep the education system functioning despite the closure of teaching learning process. All teachers were paid, school operations grants were provided, examinations were held, so children in the last grade of each level, they moved up. Primary level children completed primary, and they are ready to move to secondary. Lower secondary children completed lower secondary exam. They are ready to move to upper secondary. Upper secondary children passed the exam, and they are ready to move to tertiary. So the progression has not been affected. It has been continued. The worst affected children have been the first 3 grade of primary, who have not returned to school for now almost 80 weeks. But the education system has not frozen. It was not a dead academic year. Children are progressing from one level to another. Right. As we speak, there is an exercise going on to select the children, to assign the children to different secondary schools.
Mr. Dahal, thank you so much indeed for joining us, and we wish you the best, particularly with your assistance with the children in Uganda as they get back to school, and hopefully not too much disruption as they get back to some kind of normality. Thank you so much for joining us.
Thank you. It's my pleasure. UNICEF has been with the government before COVID, during COVID, and will continue to support the government and its partners after the COVID, so that the right of every single Ugandan child is assured. Thank you.
Thank you so much.